Hey guys, Dr. Sandal here. Today I want to talk about a patient of mine, let's call her Sam. You guys might know Sam or someone a lot like Sam. She just recently had her third kiddo and she's just not feeling right anymore. This has been going on for a while, even before her pregnancy. She was just feeling run down. She was feeling tired. She was feeling overweight, not the way that she used to feel. She used to be athletic, and now she just can't get the pounds off. And it's affecting her self-image. Her mood isn't what it used to be. She wants to be, happy and vibrant and play with her kids. It's amazing. She's got kids. Great. She's just too tired to enjoy it. This is, I think, a really, really common story. And so she came to me and she said, what can we do about this, doc? Are there pharmaceuticals? Are there supplements? Are there herbs? What can I do about this to get feeling awesome again? I want to feel vibrant. I want to have fun. I want to play with my kids. I want to enjoy my time with my husband. I want to, feel like I'm young and youthful again. There's a ton of things to say about that sort of situation. And of course, it's super common in our society. Why is it so common? It's so common because people don't talk about it thoroughly enough. We don't have enough education on how did we get there and how do we push back on that? How do we regain our youthful vitality? And this is something I talk about a lot, not just for Sam, but for young men, old women. Everybody needs this sort of concept on how do we push back on our age. That's a lot of what we talk about on this channel. But today I really want to talk about Sam. Again, you guys might know Sam. There are certainly nutritional, herbal, even pharmaceutical things that we can do to help Sam. But the thing I really want to talk about today is how important stress is in that whole concept. Now, there are people who kind of go, okay, sure, whatever. Well, no, this is a real biochemical link here. Our psychology, our sensation of not feeling well day to day affects our chemistry. Literally, when we are telling our body we're stressed, we produce more cortisol. Cortisol is one of our body's master stress hormones. It comes from the adrenal glands. And cortisol is well established to make us feel fatigued, to make us hold on to fat tissue, to make us feel more moody. And this is actually a survival mechanism. Our ancestors, when they were stressed out, entered a type of danger mode survival. Their body started to change its relationship with other people, with foods, to survive whatever that stressor was. They didn't feel powerful and confident anymore. They were in fear mode. And so when we're stressed about something, we are actually changing the way that our biology works, right? You guys have probably all heard about the idea of a mind and body connection. I would advise everyone to take that further, right? It's not just a mind-body connection. We are both those things. There's no connection because they are the same thing. And therefore, when we're stressed, our body is stressed. I often say that stress is stress. It doesn't matter whether it's a mental stress. Oh, I'm worried about this relationship, or I'm worried about my job, or if it's a physical stress. I worked out too hard, or I pulled a muscle, or I got a burn. Stress is stress. Comes down through actually common biochemical pathways. So going back to Sam, right? Sam is just feeling tired. She wants to enjoy time with her kids, but she's just feeling run down. So how do we approach that? Well, one of the foundational elements of feeling better in that situation is changing our relationship with stress. Now, this is not something that our society talks enough about. It's a huge deal. We have all of these societal pressures to go out and produce and to grind and to be perfect, to get all this stuff done, right? As part of our social media culture. The thing is, it's not reality. Humans naturally have cycles. We have activity and we have rest. And yet we all start to convince ourselves, because we imbibe all this media that tells us go, 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 go. And this isn't new to social media. I mean, this has been around for 50, 100 years now in our society. It's too much. We have to be able to be on and we have to be able to be off. This is probably fundamentally one of the reasons why Europeans, even though they have a lot of the same stimuli as us, including diet, are generally leaner than us, because they have that culture of taking time for themselves, be that around food or socialization. They will often look like they're not in a rush to people who are in the US or Britain or Germany, kind of the more kind of go, go, go cultures. But it turns out that's super powerful medicine. And that's the point I want to get across to someone like Sam. We start there. If you're feeling like you've got too much cortisol, what is that? Tired, moody, too much weight. We really have to examine what's going on with our stress levels. And a lot of that, I know this sounds weird, is a habit, it's a choice. It's something that we've done to ourselves, usually unintentionally. And then walking that back is something that takes time and effort. It's not just, oh, great, I'm going to think about it different. No, I'm not trying to say that. I'm saying it is something you have control over, though. It's a matter of building these new habits where we tell ourselves, it's okay. I can take a rest. I'm feeling tired. I'm feeling run down. Let me rebalance things. Let me come to a position in which I feel good about my first day, then week, then month, then life. How do we do that? Well, that takes a lot of attention. It takes a lot of self-awareness. And this is one of the reasons why, for instance, at Optima Clinic, we have an integrative therapist on deck. Understanding ourselves and why we have these patterns is super complicated. It just takes a lot of introspection, and it can be really, really good to have other perspectives. So I highly recommend connecting with friends or family who are thoughtful, connecting with professionals who are thoughtful to kind of go, you're pretty stressed out, right? And almost all of us are gonna go, no, this is normal. Well, I'm here to tell the Sams of the world, it's not normal to feel that wound up and that dragged out. That's not healthy, right? We kind of delude ourselves into thinking that culturally. But one of the things that I think this holiday season people should be thinking about is how tightly wound are we feeling? And see if we can start to walk that back. It's a big task. Takes time, takes attention, takes effort, it's difficult, but it is absolutely foundational. And I will tell you guys, there's all sorts of, the Ozempics and pharmaceuticals out there. There's even nutraceuticals, supplements, and herbs out there that can help with mood, fatigue, fat loss. Those things exist, but they're really all supplemental, right? Our foundation is the messaging that we're giving our own internal hormone balance, and that starts here. Okay, wishing you guys a stress-free holiday season. Catch you later.